The Abdul Latif Jameel Poverty Action Lab. Translating research into action.
So if there aren't any more clarifying questions, we'll go on to the next speaker. So our next speaker is Madhu Joshi, who is the Senior Advisor for Gender and Governance at the Center for Catalyzing Change. She has been working on gender and rights for over 19 years, initially with women's organizations and later with international agencies, including Oxfam, Great Britain, at South Asia and at the national level. Her thematic expertise extends to a wide range of gender issues, including violence against women, women's political participation, gender, and social inclusion. At Center for Catalyzing Change, Madhu is leading on its projects on women's political empowerment, preventing violence against women, and gender mainstreaming. She holds a degree in law from the University of Delhi. So we'll let Madhu start. Thank you.
Thank you, Urmy, and thank you everyone for coming over to listen to this, to our presentations. And after a lot of theory, I'd like to share how it actually works in the field. So to begin with, I'm not an evaluator. I'm more of a program implementer, and we've been trying to use evaluations to improve and inform our work. So what I'll be doing today is sharing the lessons from our project called Pahel, which is being implemented in 3 districts of Bihar with women from Panchayats institutions. So we work with elected women's representatives. We call them EWRs for short, so you'll see that in all the slides. So the objective of the project is to build their leadership skills so that they participate effectively in the meetings, that is in the Gram Sabha, Panchayat Samiti and Zilla Parishad. And also specifically in this program, which is supported by the Packard Foundation, it's to support them to take actions to improve reproductive health services offered by state health delivery systems. And additionally also to see whether they address other development issues in their constituencies. So I will begin with giving you a little bit of description about how the project operates in the field and why and how we did the qualitative assessment, which was a kind of a midterm. When the project began in 2007, we began work with 300 women in 2 blocks of Patna district, and then we upscaled it to 3 districts, Muzaffarpur, Sitamarhi and Aurangabad, where we reached 1,200 women in 6 blocks. Mainly the project strategy, since it's Bihar and we are all, I need not repeat how low it is on all development indicators including gender. So the project strategy first began with capacity development, that is training of the women in a 3-day training on understanding what is their role and their powers under the Panchayati Raj system, understanding gender and patriarchy, and also how the public health delivery system works and in the context of family planning and reproductive health. Also, over the period of the project implementation, supporting them to generate evidence so that they can demand accountability for services. How this works, I'll explain. And we have also been mentoring them by collectivizing them into Mahila Sabhas. So what the accountability framework looks like is that we train the women to use checklists which were developed with reference to established standards, and so that they can visit various levels of health facility and raise them in their panchayat and with the health departments. So what it looked like was 4 checklists were developed at the start of the project to monitor, which is the monthly village health sanitation and nutrition day, to see the services at the health sub-center, the primary health center and the district hospital. Looking at it in terms of the infrastructure, placement and availability of personnel, community participation, availability of equipment, provision of services, and also looking at logistical arrangements like whether it's clean or not, whether there's light, water supply, etc. A little bit about the women we've worked with. So this is the age group, mainly in the age of 30 to 49. Most of them elected for the first time. A very small 5.3% was elected twice. Most of them are married. And most of them hardly went to school. So the project activities looked like this. They went for the training. They met quarterly at the Mahila Sabhas to learn and share. And they were mentored and supported. We worked with, I must mention, 3 local organizations in the 3 districts, and their field animators went with the women to help them monitor using the checklist at the sub-center or the PHC, since a lot of them could not read. However, when we did 2 rounds of checklists, the women picked up on their own what they're supposed to look at. Also we organized exposure visits to Himachal Pradesh for the women from all 3 levels, the Gram Panchayat, the Panchayat Samiti and the Zilla Parishad. So we had initially some quantitative indicators which we measured at the baseline, and we saw that in 2 years' time there was a 37% increase in their attendance and monitoring of the VHNDs, and also a 24% increase in their interaction with health functionaries, that is mainly the ASHA and the Anganwadi worker and the ANM. Well, as part of the project, annual convergence meetings were organized in which the women interfaced with the district level health officials and brought the problems that they saw at the health facilities before them. So, for example, from raising the issue of non-availability of blood at the district hospital, the appointment of lady doctors, non-availability of referral transport. So, the women were very confidently raising these issues. And from the side of the health officials also some commitments were made about placement of staff, availability of ambulances. And there were more results that we were seeing in our narrative reports. So, women were raising issues of girls' education. They were going and inspecting schools to see if teachers were there, what are the kind of meals that were being served. They were helping people in their community to access entitlements in terms of pensions, housing schemes, and also demanding that actually Gram Panchayat meetings are held. You know, seeing whether they realized that they were marked as present in a lot of meetings, but were actually not there. And also looking at transparency in terms of dispersal of funds, who gets them, what activities, development activities are sanctioned. So these are things that we saw over a period of time coming in through the partner narrative reports. Because we had a very basic project monitoring and evaluation framework. We began with a quantitative baseline in control and intervention areas, and where we just measured whether they were aware of certain issues, whether they went for meetings, what were their interaction with different officials in their villages. So what we developed was an Excel sheet where every individual woman was tracked in terms of how many times did you attend the meeting, who did you meet, did you go to the Mahila Sabha, what are the nature of issues you raised at the Panchayat meetings or in your community meetings, whether it was girls' education or whether it was availability, the regularity of the VHNDs. And also the accountability checklist that the women filled in. Here I must mention that since most of them could not read or write very well, they went in groups, and one of them would be a little more literate, and of course the partner level field animator also accompanied them on these occasions and helped them to fill in, observe, talk to the officials, and also inspect the services like the quality of the labor room, for instance. And these checklists which were filled in hard copy were analyzed by us centrally, and feedback was given to them that these are the gaps. So you can raise these at your Panchayat meeting or at the district level forums. However, what we saw was instead of waiting for us to send the data back, whatever they saw instantly, like for example, that there is no examination table in the sub-center, which a remedy that they could, a problem that they could solve very easily by working with the ANM to release the untied funds, they did that instantly. So we were very keen to understand what was the motivation for change, why were some women engaging more, why were some, why we really wanted to better understand and measure the change that we were seeing in the women. So we decided to do a qualitative assessment, a midterm qualitative assessment, and these were the main objectives. What were the changes at the personal level, whether their relationship with their family and the community had changed, and whether what was the extent of contribution of the project to that. How has it enabled them to address the issues involving women and girls? What has been the motivation? This was a very key question. Why were a lot of women more active? and what lessons does it give us in terms of approaches to build women's leadership in governance. So, to begin with, this was not part of the initial project design. So, we really looked around at in-house capacity externally, at our budgets, and then we thought that whatever be the constraints, we'll go ahead and do it. So, the project team read up, we worked with a small agency, and we used most significant change, which all of you know about. And however, since we had done baseline in the control area, we decided to reference back to the control area as well. And we felt that, all right, we are doing the qualitative, documenting the stories of change, but we would also cross-reference these changes with the quantitative data that we were collecting. So, we first established the domains of change. We fixed a reference group, some tool, story collection method. We also did one FGD with the 3 partner organizations that we were working with to understand. We also had to train the field investigators, review the stories we collected, and do a little, some extent of secondary analysis. The domains of change that we identified were knowledge and awareness, personal development, attitudes and behavior, participation in development, and political activities. And within each domain, we had questions on personal and professional fronts. In terms of tools, for in-depth, since we were doing investigation also with the other stakeholders who were engaged with the women's lives, so 4 in-depth interview guides were developed for the family members / husbands, the community members, their male peers in the panchayat, and the health workers. These were the officials who they were most interfacing with. And a separate FGD guide was prepared to use with the field level project implementation team to gauge their understanding of change and challenges. For the story guides for the women, we used questions around lifestyle, how they were balancing their domestic and work responsibilities, what were their attitudes towards women in women's role in household decisions, what were their views on girls' education, child marriage, dowry, how has been their journey since the time they have been elected, what changes have they been able to make, their relationship with their male colleagues and officials, and how they have managed the different barriers that they faced, illiteracy, patriarchy, their mobility, their lack of exposure when they were elected for the first time to the external world. Many of them stepped out though they had been elected before, they had stepped out for their house for the first time when they came for our training, right? So, in terms of reference group, we interviewed in the intervention and control areas. You can see the sample. And so, today I'll just share a few stories. In terms of knowledge and awareness, this is one lady saying that how the information has actually helped her feel more empowered and built her confidence. So now she can tell people, your work will be done, I will get done when they come to her. And she says, I've become a star among my friends, and I want to be the Mukhya in the next elections. So the next elections are in 2016. In terms of personal development, someone shared that she did not want to be labeled as during the course of this journey, she realized that she didn't want to be someone's wife or someone's mother, and she feels very proud that her children are referred to as the members' sons. Yeah? And she also, this last one is very touching, that she says earlier people would not notice me, officials would not take notice of an illiterate woman like me, but now I can actually ask them to do their work. In terms of attitude and behavior, the other lady, she shares, I've overcome my fears, I'm not scared of talking to people. In the initial days, she felt lost without her husband, but now she prefers going for the meetings, but you know, depending on the timing of the meeting, she would have him drop her to the venue. So he's useful to that extent. In terms of participation and the work that they've done, they very proudly, these are many stories, sharing electricity in their ward, toilets, a motorable road, someone has stopped an early marriage in her area, calling for meetings of women. And we cross-referenced it with some quantitative data that we were gathering as part of the project monitoring framework. So you will see that their attendance at the VHNDs have gone up. This is over a period of 24 months. meeting with health providers, and attendance also at the PRI meetings. Similarly, the kind of issues that they spoke about in the meetings or with people with regard to reproductive health services and information, and also in terms of girls' education. When I say girls' education, I mean attendance in schools, community sending children to schools, their role as members of the school education committee. Bihar has a lot of schemes for girl children, so girls accessing, families accessing those schemes. What we saw also, the women were visibly confident, very proud of their achievements, and they very clearly attributed this to the part, as part of their training. When they went for the training under the project, they were all given a takeaway booklet, which many of them couldn't read, but they took it back home, though it was pictorial, and got their children and husbands to read it to them. And now they feel ultimately that they're more valued by their family and respected in the community and taken notice of by the government officials. So this is just a voice, family is proud of me. The changes that were reported, we grouped under several indicators: self-efficacy, mobility, decision-making, cognitive skills, communication skills, negotiating skills, and engagement on health issues. What we did was we correlated whatever they were stating with what was observed by their husbands, the male members of the Panchayat, the health service providers, and community members. And we also compared these changes in terms of changes or no changes reported by women in the control districts. We had done the baseline in 3 control districts. So what did the others say? The husband says that she's begun voicing her opinion on everything and is pretty well informed. Her male colleagues said that reservations are very important to get women into political life, otherwise they wouldn't have come. And these women in this Pahel project very actively participate in our meetings now. This is an A&M who says that my ward member understands the issues related to girls and women. And now, initially when these women were going and auditing the health centers, there was a sense of conflict between the health worker and the women, because many of them felt that, she would report back on her work. But over 24 months, they've actually started working together to find solutions to issues. There are many cases where the ASHA worker or the A&M can tell her that, you can raise this in the meeting and things can be done, especially at the level of using the untied funds. The local project staff also reported that, earlier they had to really persuade the husbands and assure them of the safety of their women and, to allow them to come for their trainings. But now the women come on their own. So they seem to have negotiated a little bit. In comparison, in the control locations, a woman says, I sign wherever my son asks me to sign. They rarely go to meetings. Low mobility, and they have very little, and the main thing is they have very little information about their roles and responsibilities. So we tried to analyze ourselves, what was the change, why and how. So the changes that we observed through the stories was changes in terms of their mobility, decision making, participation, changes in many of their attitudes and beliefs. Why? Most important, they wanted to be valued. So valued by their family, wanted respect in the community, and wanted to work for development. So, the key takeaway was that these women had really, their sense of self-worth, agency, and self-respect really went up as they engaged more and more with the project. Though the project told them to do one thing, that is take this checklist and go in your group and go and see the health facility, they figured that if I can do that, then I can do many other things, and including asking my male colleagues that why are these meetings not held. And how? Access to information, most important. Going for the training, which the training itself was a solidarity platform where they saw many women like them coming in for the training and many women like them as trainers. So that was a huge motivation and a window of opportunity. A solidarity platform where they met in the Mahila Sabhas and each one shared what they were doing in their areas and how they could find solutions to common problems. Exposure to new ideas, exposure to new places. Some of them actually went for a meeting with women MLAs of the Bihar Assembly and spoke about their problems. So it was it was a huge achievement for a lot of them to speak to the MLA of their area, who was also a woman, and tell her about how they really need lady doctors. A solution to that can't be found, but actually to be able to go and say that to all the way to Patna when you've not stepped out of their village was a huge motivation. So they really believe that change is possible. However, there were some things that did not change. So after all, the husband is the head of the family and he must have a greater say. When they were asked what age and how and when will you marry your daughter, does he help around the house? So his work is very important, you see. So how he is after all the guardian of the family, so how can he do the housework? However, I manage my time better so that I'm finished with all the domestic responsibilities. Then I go out of the house, finish my panchayat work and come back in time to, so that everything is done. However, he is important. We also need for our own safety. I need him to take me if the meeting is very far away. I really need him to escort me. And how can we not give or take dowry? It's our tradition. If I don't give, then the huge. So there are some attitudes which need much more work, take a lot more time for change. So in conclusion, what have been our learning as a project team on qualitative methodology? I think maybe we have missed a lot in terms of analyzing, recording a lot of the stories, because the assessment team really needs very advanced capacities for analytical thinking, developing, administering the story guides. It has very significant implication on budgets if you have not budgeted for it. It's important also to validate personal stories through other stakeholders. So to see that the change that the woman is speaking about is how is it perceived by others. Quantitative information to supplement the outcome of MSA always helps to visualize. Everybody wants to know how many, how much, how often. And finally, who is the evaluation for? So if it doesn't feed back into your program implementation cycle, then we feel that the task is incomplete. So in terms of what has been our program learning in a women's leadership program, so women need both. They need information about their work, how to do their work, but also need constant support to negotiate patriarchal structures. Handhold support and mentoring, and that too is needed for a long period. The trainings, which is the first step, offer a great window of opportunity for women to know about their own power and what they are capable of. Building women's solidarity platforms always gives them confidence to engage, confidence to challenge. And also, once we give them tools for effecting change in one area, on one issue, they really take it forward, maybe for both reasons, like I've spoken about, gives a huge boost to their self-esteem, they feel valued, and also they want to work for, be effective leaders. So they go and engage in other issues as well. So yeah, so that's what we have to share in terms of program learning. I think I'm well in time.
Great, thank you very much. So are there any clarifying questions before we go into the more broader discussion? Where's the mic? Oh, sorry.
Yeah, hi, I'm Kiran Shaiva from iDobro. I have a very simple question. In the graph that shows the profile of the ladies, you mentioned that, the maximum number, obviously those who are first timers, and there's just 5% that had been re-elected. Wouldn't that be a very important indicator of the success of the program? Because I didn't see that coming out anywhere else, and I'm wondering how is that it was mostly all first timers.
Sorry.
Okay. Yeah, it's interesting for us that first timers, working mainly with first timers, we've had seen more success. Though we see, when we see in the groups, those who are second timers are more vocal. But over time, when the first timers and the second timers work together, yeah, you're right.
Yeah. No, I just want to know, would you all not use that as a baseline indicator too? Because over a period of time, you'd expect that the success would have led them to be re-elected. And that could have been a very critical indicator. So just
we didn't look at that. Also, in Panchayat, the seat rotates, so the constituency rotates. Even if there is reservation, in Bihar there's a 50% reservations, but the constituency next time may not necessarily be reserved for women. However, a lot of them, it's even in the Hunger Project, you may have seen that the women do get re-elected. But in this one, we didn't.
Hi, I just wanted to check, how did you measure for cognitive skills, improved cognitive skills in the qualitative component?
We had a detailed questionnaire with that we can share with you.
Hello, I just wanted to know that the very fact that they stood for elections sort of makes them a hero of sorts. So I just wanted to know, like, what do you think, like, drove them to, stand for elections? Was it like the presence of their own, like their own presence in the village, or their husbands, or maybe something like that? Do you have any data that you collected on this?
Well, I think it's a common experience when reservations were made for women in panchayats. It's always, most of them came in as proxy candidates for their male relatives in a lot of cases. Also, there were some, a lot of them came in because the community, because that seat was reserved, so one or two of them did mention that, her husband encouraged. The other story that we got was that she said, if I I stood for elections, she was a Dalit woman, and she said, I will get some benefit out of it, because she saw a lot of the male ward members becoming richer because of their engagement out of scheme. So most of them were pushed to stand for elections, yeah. This we figured in the training. And what would happen continuously is that their husbands would come for the meetings. And so when they were being trained, the husband said, I go for the meeting, so why should I not be part of this training? I also need to listen to it, your training. So yeah, so that was the change, that over time then she started. And so when we interviewed the husband, they said she was so nervous. She was, in any case, this was a scheme of the government, so women had to be there, but I know better and I would go. For now, over time, in a lot of cases, it changed. But there would be many where it would not have changed. The husband would have gone. So I'm not making any claims on that.
So I have a two-part question. First of all, I'm very glad that even in a qualitative analysis, you included a control group. So how did you select the control group? And assuming it was elected women representative, where Pahel program did not happen, the whole theory of change of having reservation was, if you give the electoral power, there would be change in women's empowerment. Did you not see any change in the control group, like any positive change?
In the stories, we did 30. I think we did 30. Just a moment. We see the control group selection was random. And so was the intervention. However, what we saw in the control group, the 30 stories, we did, just a minute, I'll give you the exact figures. Yeah, we interviewed 18 women in the control groups and 30 in the intervention groups. In the 18 stories that we collected, we actually did not see them going for meetings, or very, very confident that when the son, in most cases it was either the son or the husband or the jate who would go for the meetings, and not just for the panchayat meetings. Even we had a question about have you gone out of your village? Yeah, have you visited the district? Even there, most of them had not, a lot of them had not stepped out. Though they were informed about, say, some of the stories were about that, yes, meetings happen. They knew that Gram Panchayat meetings happen. Yes, they are the members. But since I cannot contribute, why should I go? So that was the...
I find it very significant, because that means just reservations would never going to help anybody unless there is a nudge like Pahel to build the capacity, right? That would be one of the key findings then. Just like, would you agree?
I wouldn't dare to make such a drastic statement, because there have been, ours is a small project in 6 districts, and we see projects are run by many other organizations, by the Hunger Project, many others. And yes, definitely mentoring and collectivization certainly motivates them. But in many cases now we have a lot of stories about women making it on their own, motivating others. And so longer term, and re-election. Now, as women go in for are re-elected, they become more. Like when they visited Himachal Pradesh, the women there were much more empowered and more vocal, and also because they were re-elected. Yeah.
Hi, I had a general question, but first I'll start with a specific question for you, Madhu's. Taking off on what you just mentioned, I was wondering about whether when you, in the experimental districts itself, or your intervention district actually, because this is qualitative, whether you also had stories from the family members and male colleagues that were negative. You highlighted in the presentation the more positive stories, and you were looking for collaboration for the measures of change in the women themselves. So whether you had the negative side of it also, or whether there was a bias in how people were reporting because they knew that you all were evaluating Pahel itself. And the second more general one is to both people, and I think even Urmy might, since you're part of this whole consortium with measurement. When you talk about evaluation of an intervention like this, especially with qualitative data, have you, do any of you all have examples where you've taken the evaluation findings back to the community and what impact that had on the community itself?
First one is about the negative biases. Yes, there were. In the questionnaire for the husbands, I mean, we had this husband, in case the husband was not there, then any other family member, but in most cases we did find the husbands. And the question was about if more and more women come into political life, what will be the impact on the family life? There were a couple of questions around that. And yes, there were, in a few cases, the men said, yes, if the औरत बाहर जाएगी, तो घर का तो माहौल बिगड़ेगा ही. But if she, but it's depends on her. If she's a good woman and she manages to balance and give equal time to her family and all that, they would, since they were being interviewed, they didn't want to be too negative. But yes, they definitely this thing about domestic work, looking after, managing the entire home, the family honor. Is definitely the woman's responsibility. That was that came across, and also that if she spends more time outside the house, that it will disturb the so-called family balance. Yes, it did come out.
Do you want to go first, and then I'll
you go ahead.
Okay. Do you want me to just? So your question was any experience of having taken evaluation findings back to the community. Okay, this is a difficult question on many levels, because number one, who commissions the evaluation is a pretty critical stakeholder, and so and then who represents the community. So there are a lot of questions around how do you define and who do you take it back to. I can say that that's in my experience. A couple of evaluations I've done in former lives. One was an organizational assessment that was part of a program evaluation as well, and which had mixed findings. And certainly, yes, I mean, we took it back to the, I mean, mainly the organization commissioned us to do this work, so it was reporting back, but also sitting with them and with the range of stakeholders and sort of looking at what we had found and trying to look at you know, what were the factors or drivers of some of the more difficult or things that didn't seem to work, having them reflect. But that's also a very responsible exercise to carry out. So it's not, so you have to design certain ways of sharing this information with the range of different kinds of stakeholders, including their communities, their project participants, but also the staff, implementing staff, but then also being able to set up ways that they can learn and reflect and you know, use it as an opportunity for more constructive figuring out the next steps and what they would change, etc. So yes, I mean, that kind of work in a smaller setting, it's possible. But then when you do very large survey-based, very large evaluations, etc., it's I mean, on the one hand, you do need to have you have several layers between who's doing the evaluation and who's commissioning it, and then going back to how do you feed that back in, and that's definitely a challenge in the field. So very good question to ask, and ways we should be thinking about. But there are many dissemination mechanisms that organizations and that people do use, and some of them may be, you know, an evaluation nowadays is no longer that report alone that that's, you know, is shelved somewhere that no one looks at or is just done as a routinized exercise. I mean, it may be in some cases, but I think there's also so much interest and appetite for building different ways of use and using it to build constituencies around your issues. So there are many different ways that evaluation findings do get back to a range of people and communities, whether practitioners or implementers, or so those kinds of dissemination mechanisms are quite multifold nowadays. So there are so it's a little bit of a conceptual shift in also thinking about how do you take something back. It's if you're building knowledge about a particular field, that's one way, but or about a particular experience. But there are also these different dissemination mechanisms, and
So this project, Pahel, was initially crafted as using women as advocates, as social advocates to monitor reproductive health services and ensure state accountability, because the PRI members have a clear role under the National Health Mission. And however, how they should engage is not very clearly chalked out. So this project was mainly to, you know, to find ways in which women and women in panchayats can engage and ensure that services reach who deserve. So this evaluation, actually, the way we are taking it forward back into the project, in terms of that the women are feeling very encouraged to continue participating, and also in terms of as a scale-up model, we introducing an IVRS system of monitoring. So we've seen that most of the women have and use mobile phones. So we're using that platform as a low-cost mobile technology as a platform to inform them more about different schemes and services and entitlements, and also the different service level benchmarks that are available at health facilities. And also for them, now instead of taking a hard copy checklist to the health facility, they can actually see and then call up on the number and try to feed in the data. So that's something that we are trying to do. Yeah.
Okay, are there any more clarifying questions? Yes, okay.
Development Studies, Chennai. I just wanted to know, right in the beginning you had a question saying that one of the things that you were looking is to how effectively they are participating in the meetings.
Yes.
Yeah. How effectively you are trying, are they, participating in the meeting, and how do you unpack effectiveness? Are you what were you looking at when you mean effectiveness?
When we say effectiveness, we mean actually going to the meetings and speaking and raising issues around, we had also identified around health and education. Also calling for the 4 mandatory Gram Sabhas in the area. Many of the women head their panchayats, so they are the mukhyas. So calling for the 4 Gram Sabhas in a year. And also not just panchayat meeting, there is a system of a Rogi Kalyan Samiti which works in some places and doesn't. So their participation going there for those. And also different meetings that are organized at the block and the district level, sometimes organized as part of the project, sometimes they called the, see, we didn't only work with the panchayat, Gram Panchayat members, we also worked with women members of Panchayat Samiti and Zilla Parishad. Though honestly, the Gram Panchayat, at the Gram Panchayat level, we did see better results. Yeah, so.
Hi, I'm Aparna. This is a question for Madhu. So specifically about your exposure visits. So I assume that would have been at the beginning of the training, taking people to Himachal?
Actually, the exposure visit was about a year after, after the training, yeah.
Okay, which leads in really well to my next question. Why did you offer it at this stage? And did you face any reticence from husbands, sons, from the women themselves about traveling so far away?
Okay. Honestly, the exposure visit was planned as part of the project implementation plan within the first year. However, due to various coordination and other reasons, there are so many festivals, harvest, etc. happening, and also our thing and coordinating with Sutra for the visit, it took that much time. In terms of going for the visit, we also went through a selection process. Most women wanted to come. So we wanted to take a mix of groups of women from all 3 levels, and women who would also engage, who were more motivated. I mean, who were actually doing work on the ground, who would voluntarily come for the meetings instead of, you know, the field animator going. And in terms of opposition from home, some of them came informing their families that they were going, and they were going with thing. Many also came telling them they were going to Patna for a project meeting, and some others said they were going, some relative was ill and so they had to go there, and yes, there were stories like that also. So yeah, so those barriers, so they've been able to very cleverly negotiate a lot of the barriers, not necessarily always challenge and overcome them. Yeah.